Chapter 13. Why do we fall ill? Health and disease. You might have heard of natural disasters like earthquakes, cyclones, tsunamis, etc. In these natural disasters, human health is adversely affected in the form of physical injuries or trauma. The after effects of disasters causes accumulation of dead and decaying organisms in the surroundings, which leads to the spread of many fatal diseases. If these diseases spread, it can result into epidemic, which may affect our health. Hence, we can understand that health and disease in human community is a very complex issue with many interconnected causes. To understand about health, disease, and its causes, let us first understand about the constitution of our body.
The cell is a structural and functional unit of all living organisms. The cell is made up of various components like carbohydrate, protein, lipid, etc. In our body, various tissues and organs carry out various processes. For example, the lungs carry out respiration, the kidneys perform the function of urine formation, and the brain carries out the process of thinking. All these activities are interrelated with each other. For example, if the process of urine formation is not carried out by the kidneys, then the poisonous substances will get accumulated in the body. In such a situation, the brain will not be able to think properly. The activity of cells, tissues, or organs needs to be maintained to carry out all these interrelated processes. The organism obtains necessary energy from the food to maintain the activity of cells, tissues, or organs. If any object or factor disturbs the activity and it creates certain abnormal situation, is known as disease. Health and its failure. All of you must have heard the word health used quite frequently. You have also heard people inquiring about your grandparents' health. If your grandpa is not well, then he replies that his health is not good. When people meet each other, the first thing they ask about the health of each other. Now, you must have a question in your mind. What is meant by good health? Good health means physical, mental, and social well-being. If a person has a state of being well enough to function physically, mentally, and socially, then it can be said that he has good health.
Personal and community issues affecting health.
The health of all organisms will depend on their surroundings or their environment. For example, our health is at risk in a natural disaster like cyclone in many ways. Besides this, our society is also an important factor to maintain individual health. It is very much important that human beings live in society because our social environment is an important factor for individual health. We live in villages, towns, or cities. In such places, even our physical environment affects our social environment, which directly or indirectly affects our health.
You must have noticed the person coming to your house to collect garbage in the morning or at a particular time every day. These persons are a member of some agency of your city. Now, consider what would happen if no agency ensures that garbage is collected and disposed. What would happen if no one takes responsibility for clearing the drains and ensuring that water does not collect on the streets or in the open spaces?
There would be a dump of garbage thrown on the streets, or there would be drain water lying stagnant around where we live. The possibility of poor health increases. Therefore, public cleanliness is important for individual health. Nutritious food in proper amount is necessary to maintain good health. But nutritious food can be obtained by earning money. For this, it is necessary to get a good job. Thus, good economic condition and a job are necessary to maintain good health. Besides these, it is important to stay happy to maintain good health. In turn, we can also remain mentally healthy. In fact, if we misbehave and stay in conflict with each other, then we cannot remain healthy. Thus, social harmony and unity is an important factor for individual health. We can think about other examples also where there is some connection between community issues and individual health. For example, if you cannot maintain harmony at school or at office, then there is a possibility that you may suffer from various mental diseases like stress, irritable nature, and sadness. As a result, individual health becomes poor, and if such a situation remains for a long time, it may result in diseases like blood pressure, sleep deprivation, etc. Thus, individual health can be attained by maintaining social harmony. Distinction between healthy and disease-free. Disease means being uncomfortable. In short, disease means specific and definite restlessness. But the possibility of poor health cannot be neglected without suffering from any specific disease. The meaning of health varies according to the person and his or her occupation. For example, good health for a dancer may mean being able to stretch his or her body into difficult but graceful positions. On the other hand, good health for a musician may mean having enough breathing capacity in his or her lungs to control the notes from his or her flute. This is the reason why when we think about health, we think about the society and community. Whereas, when we think about disease, we think about individual sufferers. Disease and its causes. How to identify the disease?
Let us understand a little more about diseases. We know that when there is a disease, there is something wrong within the body. Our body is made up of various tissues that make up the organ systems. Each of the organ systems has specific organs which have particular functions. The digestive system has the stomach and intestines which helps to digest food taken in from outside the body. The musculoskeletal system is made up of bones and muscles that holds the body parts together and helps the body move.
You know, disease means specific and definite restlessness. So, how do we know that there is a disease? When there is a disease, either the functioning or the appearance of one or more systems of the body will change for the worse. Due to this change, symptoms and signs of the disease originate. Symptoms such as not feeling well, vomiting, loose motion, etc. show that the disease has been caused. But they do not indicate what the disease is. For example, headache may be the symptom of any of the diseases such as examination stress, migraine, or common cold. Doctors diagnose the disease on the basis of signs and symptoms. These signs will give a little more definite indication of the presence of a particular disease. Nowadays, doctors will also get a laboratory test done to diagnose a particular disease.
Acute and chronic disease. Different diseases have different manifestations depending on a number of factors. Duration is one of the factors that determines the type of a disease. Some diseases last for a very short period of time and are called acute diseases, whereas diseases that last for a longer time, even for lifetime, are called chronic diseases.
Acute diseases. Disease like flu is an acute disease. Flu shows sudden and rapid onset. Its effect is direct and fast on our body. Its effect lasts for a short period of time in our body. As a result, it does not cause any bad effect on the human body. Thus, a disease or disorder that has rapid onset, its effect is fast, but lasts for a short period of time, is called an acute disease. Other examples of acute diseases are cough, common cold, typhoid, cholera, etc. Chronic disease. A chronic disease is a disease that is long-lasting. The symptoms of such chronic disease last for months, years, or even for a lifetime. The effect of this disease on the human body is intense and remains for a long period of time. For example, elephantiasis, tuberculosis, diabetes, cancer, and arthritis. Chronic diseases and poor health. Acute and chronic diseases have different effects on our health. For instance, an acute disease shows rapid onset and shows mild effect on our health, whereas the effect of chronic diseases is intense and stays for a long period of time on our body. For example, if we think about common cold, which occurs often, we all get well within 1 week, and it will not leave any bad effect on our body. We do not lose our weight at a long period of time. We do not face difficulty in breathing, or we do not feel tired due to common cold. But if we get infected with a chronic disease, like tuberculosis of lungs, then we remain ill for years. We gradually lose our weight and we feel tired all the time. Thus, we can say that acute and chronic diseases show different effects on our health. Causes of disease. You might have a question in your mind. What are the causes of diseases? When we think of the reason of the diseases, we should consider that there are many different levels of causes of the diseases. For example, when a child is suffering from intense loose motion, then the main cause of this disease would be the infection with a virus. Now, a question may arise. Where did the virus come from? Suppose we find that the virus came from the unclean drinking water. But the unclean water is drunk by many children. Then, why is it that one child developed loose motions, while the others did not? One reason for this may be that the health of the child is not good. Consequently, it may happen that the risk of disease in this child is greater, whereas the other healthy children are not at a risk. Thus, poor health is the first level cause of the disease. Now a question may arise, why this child suffering from loose motion is not healthy? Perhaps this child is not well nourished. So, lack of good nourishment becomes a second level cause of the disease. What is the reason that the child is not getting clean drinking water? There is a possibility of lack of proper public services in the area where this child lives. So, lack of proper public services becomes the third level cause of the disease.
It is also possible that the child has some genetic difference that makes it more likely to suffer from loose motions when exposed to such a virus. Thus, we can say that the virus is the immediate cause and the other factors form the contributory causes for the disease.
From all these discussions, we can conclude that one or more than one cause is responsible for the disease.
Infectious and non-infectious diseases. The immediate causes of disease are of two distinct types. One type of cause is through the infectious agents, mostly microbes or microorganisms. Diseases wherein microbes are the immediate causes are called infectious diseases. These microbes spread in the community and cause diseases. The other type are the diseases that are not caused by infectious agents. Their causes are mostly internal and non-infectious. Such diseases are called non-infectious diseases. The ways in which diseases spread and can be treated or prevented are different for different diseases. This is because it depends on whether the immediate causes are infectious or non-infectious.
Infectious diseases. Certain pathogens or disease-causing organisms like virus, bacteria, fungi, protozoan, worms, and nematodes, etc. cause infectious diseases. Such disease-causing organisms are easily carried from one person to the other by some factors like air, water, food, physical contact, and some other carriers. Thus, infectious diseases are spread from a diseased person to a healthy one. Non-infectious diseases. The disease that does not spread from the diseased person to the healthy one by a causative agent is called a non-infectious disease. For example, diseases like cancer, high blood pressure, injury, and physical damage. Now, consider a disease like high blood pressure can be caused by excessive weight and lack of exercise. Another example is a cancer in some definite organ of the body, which is caused due to the uncontrollable growth of the tissue cells of that particular organ, and genetic abnormality is the main reason for this. Whereas, accident is the main cause for an injury and physical damage to the body. Infection is not a cause for all these diseases. Socially, the causes of the disease, cure, and prevention are different for different disease. This depends on whether the disease is infectious or non-infectious. Infectious diseases. The diseases caused by coming in contact with infectious agents are called infectious diseases. Now, let us study in detail about organisms responsible for infectious diseases, their spreading, and how do they enter into our body? Infectious agents. The organisms responsible for causing diseases are present in large numbers in our surrounding. They are classified into various types because of their vast diversity. For example, virus, bacteria, fungi, unicellular protozoan, etc. Besides this, some multicellular organisms are also responsible for causing diseases. For example, various types of worms. Diseases like common cold, flu, dengue, and AIDS, etc. are caused by virus, whereas diseases like typhoid, cholera, TB, and anthrax are caused by bacteria. Some skin infections are caused by different types of fungi. Besides this, malaria is a disease caused by protozoans.
Another disease caused by protozoans is Kala Azar. Intestinal worm infections and elephantiasis are caused by different species of worms.
Why should we think about the causative agents of the disease? The information about the infectious agent is very useful to decide the treatment for that disease. Many varieties are found in bacteria and virus.
Members of the group bacteria have many biological characteristics in common. Similarly, members of the group viruses also have many biological characteristics in common. All viruses are dependent on the host cells to multiply, while bacteria can multiply independently. Viruses, bacteria, and fungi multiply very quickly in comparison with worms that multiply slowly. Taxonomically, all bacteria are closely related to each other, but not with viruses. Similarly, all viruses are taxonomically related to each other, but not with bacteria. This means that many important life processes are similar in the bacteria, but are not shared with the viruses. As a result, medicines that block one of the life processes in one member of a group of bacteria is likely to be effective against many other bacteria of the same group. But the same medicine will not work against pathogens belonging to a different group like viruses.
Many bacteria form a cell wall for their protection. Antibiotic penicillin obstructs bacteria in constructing the cell wall. Consequently, the growing bacteria become unable to form cell wall and die easily. As you know, that human cells are devoid of cell wall. Hence, penicillin does not affect human cells. On the other hand, virus does not use this biochemical pathway. So, penicillin antibiotic does not affect the virus.
Penicillin will be effective on any bacteria that use similar processes for making cell walls. An antibiotic can work against many species of bacteria rather than simply working against one. Such antibiotics are called broad-spectrum antibiotics. The antibiotics that can work against only a few types of bacteria are called narrow-spectrum antibiotics. The antibiotics effective against bacteria are ineffective in the case of viruses. This is because bacteria and viruses are taxonomically different, and also viruses do not carry out any metabolic processes themselves. Instead, viruses rely on a host cell to carry out these processes for them. Therefore, viruses cannot be treated with antibiotics as it is impossible to harm the virus without harming the host cells. That is why, when we have a common cold, which is caused by virus, taking antibiotics does not reduce the severity or the duration of the disease. But in case we also get a bacterial infection along with the viral cold, taking antibiotics will help to reduce the severity of the bacterial infection and not the viral infection. Have you ever heard about peptic ulcers? Peptic ulcers refer to painful sores or ulcers in the lining of the stomach or first part of the small intestine called the duodenum. The symptoms include acidity-related pain and bleeding in the stomach and duodenum. It is caused by a bacterium, Helicobacter pylori. These bacteria are found in the lower part of the stomach of patients having peptic ulcers. This finding was first done by an Australian pathologist, Robin Warren from Perth. His findings were later studied by Barry Marshall. They both conducted treatment studies and showed that patients could be cured of peptic ulcer when the bacteria were killed off from the stomach. This pioneering discovery by Marshall and Warren helped in the treatment of peptic ulcer disease, which can now be cured in a short period of time with the help of antibiotics. They were awarded Nobel Prize in the field of physiology and medicine in 2005 for this achievement.
Means of spread. How do the infectious diseases spread? Let us understand this. Microorganisms spread from an infected person to the healthy person by many ways.
As the disease-causing microorganisms are passed on or communicated from an infected person to a healthy person, such diseases are called communicable diseases.
Diseases spread through the air. Common cold, cough, tuberculosis, and pneumonia are the diseases spread through the air. Such diseases spread through sneezing or coughing of the patient. When the patient sneezes, many droplets are produced. Such droplets enter into the healthy person standing close to the patient through breathing, and the healthy person gets infected by the disease.
Diseases that spread through air are called airborne diseases. These diseases are more likely to spread in more crowded areas. When an infected person sneezes or coughs, droplets are released into the air that contains the pathogens. Large droplets settle on the ground, whereas the small droplets evaporate to form droplet nuclei. These droplet nuclei are then carried by the air. The droplet nuclei get easily transmitted to a healthy person from an infected person. In a closed room, the droplet nuclei get circulated and pose a risk to the people living in the room. Thus, overcrowding and poor ventilation of rooms is a major factor in the spread of airborne diseases. Diseases spread through contaminated food and water. Diseases can spread through contaminated food and water. For instance, cholera, an infectious gut disease, is transmitted through water. In such a case, the transmission occurs if the excreta of the person infected by cholera gets mixed in water. The pathogens of the disease gets into the water, and if such water is used for drinking purpose, the pathogens enter new hosts and thus the cholera is spread. Diseases can also spread through food kept uncovered, which gets infested with flies carrying the pathogens. Such diseases spread rapidly in the absence of hygienic conditions. Diseases spread through contact. Many skin diseases are spread through direct physical contact. For example, scabies, ringworms, etc. Diseases like syphilis and AIDS are examples of diseases that spread from one partner to the other through sexual contact. But always remember that a disease like AIDS does not spread by casual physical contact such as shaking hands, hugging, or sports like wrestling or any other way. AIDS is also transmitted through body fluids such as blood when the blood of an infected person is used for blood transfusion. Sharing of syringes in drug addicts also lead to the spread of the disease from an infected person to a healthy person. It also gets transmitted from an infected mother to her baby during pregnancy and breastfeeding. Diseases also spread through indirect contact when the materials used by an infected person are used by a healthy person without proper disinfection. Such diseases are known as vomit-borne diseases. Diseases spread through vectors. Some diseases are transmitted through vectors such as insects and animals. These carry the pathogens from an infected person to another potential host. The insects or animals are thus the intermediate agents and are called vectors. The most common vectors are the mosquitoes. In many species of mosquitoes, the females need highly nutritious food in the form of blood in order to be able to lay mature eggs. These female mosquitoes feed on many warm-blooded animals, including human beings. In this way, they can transfer diseases from one person to another. Malaria and dengue are examples of diseases transmitted by mosquito bites. In malaria, the female Anopheles mosquito that suck blood from an infected person carry the pathogen, and when it bites another person, the pathogen is transferred to the new host. Thus, the disease is spread. Rabies, a viral disease, is transmitted through the bite of a rabid animal. Organ-specific and tissue-specific manifestations.
The organisms responsible for causing the disease enter our body through different means. Thereafter, they enter in many possible places like organs or tissues. The organisms spread in the air enter the lungs via the nose through respiration. For example, tuberculosis causing bacteria. If the organisms enter through the mouth, then they inhabit in the intestine. For example, typhoid causing bacteria, whereas the virus that causes jaundice enters the liver. HIV causing AIDS generally enters in our body through the sexual organs, whereas protozoan causing malaria enters in the liver through a mosquito bite. From here, the protozoan enters the red blood cells. The virus causing brain fever will enter through a mosquito bite and infect the brain. The signs and symptoms of a disease will depend on the tissue or organ which the microbes target. When the lungs are the target, symptoms like coughing, cold, and difficulty in breathing, etc. are seen. When the liver is the target organ, then the symptoms of jaundice are seen. If the brain is the target organ, then symptoms like headache, vomiting, dizziness, and unconsciousness are seen.
Thus, signs and symptoms depend upon the target of the pathogens in the human body. Some of the other common effects of infectious disease may be seen due to the body's immune system. Our immune system fights against the microbes that produce the disease. During infection, the immune system is activated. It sends many soldier cells to the affected tissue to kill the microbes. This causes inflammation. Due to inflammation, there are local effects like swelling and pain and general effects such as fever.
In certain cases, tissue specificity of the infection leads to general effects. For example, in HIV infection, the virus enters the immune system and damages it and obstructs its functioning. As a result, HIV-infected patients cannot fight against minor infections that the body faces every day. For example, if an HIV-infected patient suffers from common cold, then cold will be converted into pneumonia due to the failure of the immune system. In the same way, a minor infection in the intestine will result into severe diarrhea, and ultimately, because of many infections, the patient suffering from AIDS dies.
The severity of disease manifestations depend on the number of microbes in the body. If the number of microbes is very small, the disease manifestations may be minor or unnoticed. But if the number of the same microbe is large, the disease can be severe enough to be life-threatening. The immune system is a major factor that determines the number of microbes surviving in the body.
Principles of treatment. Infectious diseases can be treated in two ways. One way is by reducing the effect of the disease, and the other is by diminishing the disease or by destroying the cause of the disease. Treatment given to reduce the symptoms of this disease does not kill the infectious microorganisms. As a result, the person does not become free from the disease completely. Thus, it is very important to kill the microorganisms to cure the disease completely. Microorganisms are classified into various groups. For example, bacteria, virus, fungi, and protozoan. Microbes of each group show some specific biochemical reactions which is specific for each group, whereas the other group lack such biochemical reactions. Such biochemical reactions can be for respiration or synthesis of new substances. The reaction that takes place in the microorganisms may not be useful for the human body. For example, in our body, the method used by the cells for the synthesis of new substances may be different in bacteria. We should invent such a medicine which obstructs the process of synthesis of newer substance in bacteria, but which does not affect the cells of the human body. We use antibiotics as this type of medicine. The method used to make antiviral medicine is complex than the process used to make antibacterial medicine, because the virus shows less biochemical functionality. Virus enters the cells of the human body and uses the human body's organized machinery for its biological processes.
Hence, there are relatively few virus-specific targets to aim at. In spite of this restriction, there are now effective antiviral drugs, for instance, the drugs that keep HIV infection under control. Likewise, there are medicines that are effective against protozoa and can kill it. For example, drugs against the malarial parasite.
Principles of prevention.
Now let us understand about the aspects of getting rid of an infection in a person who already has the disease. Before that, let us look into the limitations of this approach. There are 3 limitations of dealing with infectious diseases. The first limitation is that once a person is having a disease, his body functions are damaged and may not recover completely. The second limitation is the time required for the treatment. It takes time for the proper treatment, during which the person needs to take complete rest. The third limitation is that the diseased person may serve as the source from where the infection may spread to other healthy people. This leads to the enhancement of above factors. So it is said that prevention is better than cure. Then, how can we prevent diseases? There are 2 ways in which diseases can be prevented. One is a general approach, and the other one specific to each disease. General ways of prevention of infectious diseases. The general approach of preventing infections is mainly related to the prevention from exposure. Let us now understand about the ways by which we can prevent the exposure to infectious microbes. To prevent the airborne infections, residential arrangements should be such that it prevents overpopulation. Overcrowding of people should be controlled and prevented. One should try to prevent water from contamination. Water contaminated through microbes must be processed to make it pure, and clean drinking water should be provided. This prevents the spread of waterborne microorganisms. To prevent vector-borne infections, we should provide a clean environment by destroying mosquito breeding places. Public hygiene campaign is the primary step for the prevention of infectious diseases. It is also very important to have better immunity in the human body, besides the control of external factors to prevent the diseases. It is very important to consume nutritious diet in appropriate amount to improve the immunity of the body. Specific ways of prevention. Immunization. The specific way of prevention is through immunization. It is related to a peculiar property of the immune system that usually fights off microbial infections. For example, in case of chickenpox, if you had chickenpox once, there was no chance of suffering from it again. So, having the disease once was a mean of preventing subsequent attacks of the same disease. This happens because when the immune system first encounters an infectious microbe, it responds against it and then remembers it specifically. So the next time that particular microbe or its close relatives enter the body, the immune system responds with even greater strength. This eliminates the infection even more quickly than the first time. This is the basis of the principle of immunization. Body of an organism has the ability to resist disease or stop the progress of it. This ability is called immunity. Immunity is also defined as the resistance to the onset of a disease after infection by harmful germs. Immunization. It is the process by which an individual's immune system gets equipped to fight off an infectious agent. In the traditional Indian and Chinese medicinal systems, the skin crusts from smallpox victims were deliberately rubbed into the skin of healthy people to induce a mild form of smallpox that would create resistance against the disease.
Edward Jenner, a British scientist, developed a vaccine for a disease, smallpox. Noting the common observation that milkmaids generally do not get smallpox, Jenner concluded that the pus in the blisters which the milkmaid received from cowpox protected the milkmaid from smallpox. This prompted the discovery of smallpox vaccine. Smallpox is an acute contagious viral disease. The pustules leave a permanent scar on the body.
Whereas cowpox is a very mild disease. Jenner deliberately administered cowpox to people and found that they became resistant to smallpox. This was because the smallpox virus is closely related to the cowpox virus. The word vaccination has come from a Latin word vacinia, which means cowpox, as the origin of vaccination was associated with cowpox. A kind of recurring immunity can be induced by introducing dead or weakened microbes inside the body. This technique is called vaccination or immunization. A vaccine is any germ or germ substance introduced into the body to develop resistance to a particular disease. Vaccine actually is a very low amount of inactive or dead viruses or bacteria. The viruses or bacteria are made inactive or dead and then injected in the form of a vaccine. As a result, when injected, they do not cause the disease, but the cells producing immunity are stimulated. If the healthy virus or bacterium invades again, these cells resist and prevent the disease from occurring. Thus, the human body avails protection against various diseases. By vaccination, we can fool the immune system. A vaccine contains preparations of dead or inactive microorganisms or their substances that mimic or behave like the pathogens. When a vaccine for a particular infection is introduced in the body, it does not actually cause the disease. The vaccine prevents any subsequent exposure to the infecting microbe from turning into an actual disease. Several diseases like cholera, typhoid, chickenpox, tuberculosis, smallpox, and hepatitis can be prevented by vaccination. Hepatitis A virus, which cause jaundice, are transmitted through water. In India, majority of children become immune to hepatitis A by the time they are 5 years old. This happens because they are exposed to the virus through water. Under these circumstances, the administration of health department is recommended to avoid any incidence of the disease by introducing vaccine against hepatitis A in children. Anti-rabies vaccine for both humans and animals are available to prevent the infection caused by rabies virus, which is spread by the bite of infected dogs and other animals. In your childhood, you must have been given injections and oral doses to protect yourself against certain diseases. For example, BCG vaccine at birth, triple vaccine against diphtheria, whooping cough and tetanus, polio vaccine against the poliomyelitis virus, and also individual vaccines against diseases like measles, diphtheria, and tetanus. It is necessary that the vaccines are administered according to a fixed timetable to protect the child against diseases. Awareness and public participation is a key factor contributing to the success of vaccination programs. These health measures are made available to all through community health programs.
Diseases in human beings.
Malaria. Every year, approximately 2 lakh people die of malaria. Hence, malaria is a fatal disease for human beings. Causative agent: Plasmodium vivax and Plasmodium falciparum of the phylum Protozoa. Cause of disease: microbes of the disease enter in the human body through a bite of female Anopheles mosquito. Symptoms of the disease: headache, extreme muscular pain and fever. The period of attack of malaria lasts for 6 to 8 hours and has 3 stages. 1. Cold stage. In this stage, onset of fever takes place with severe shivering. 2. Hot stage. Severe fever with the increased respiration rate and heartbeat. 3. Perspiration stage. In this stage, the patient perspires and the fever goes away and the temperature of the body becomes normal. Swelling in spleen and liver takes place due to malaria. The patient feels weak after recovering from malaria. Prevention. Malaria can be prevented by protecting human body from mosquito bites. This can be done by following some precautionary measures like accumulation of water should be avoided as it helps in breeding of mosquitoes. Insecticides should be sprayed to kill the adult mosquitoes. Usage of insect repellents and fitting wire gauze on doors and windows prevents the entry of mosquitoes. Sleeping under mosquito nets prevents from mosquito bites. Kerosene can be sprayed on water bodies and larvivorous fishes like Gambusia and guppy can be introduced to prevent the breeding of mosquito larvae. Treatment. Quinine drugs should be given for treating malaria as it is effective against most of the stages of the malarial parasite. Tuberculosis. In today's world, maximum number of adult illness and death are due to a communicable disease known as tuberculosis, TB. Causative agent. It is caused by rod-shaped bacteria called Mycobacterium tuberculosis. These bacteria usually attack lungs but can also attack any part of the body such as the kidney, bone, spine and brain. If proper treatment is not taken, then TB can be fatal. It spreads through the air from one person to another. These bacteria enter into air when a person with active disease of TB coughs or sneezes, shouts or spits. Tiny droplets of saliva or mucus containing the infectious bacteria are expelled into the air which infect the people nearby. Signs and symptoms of tuberculosis. Bad cough that lasts for longer duration. Weight loss, coughing up blood or mucus, fever and chills. Prevention. BCG, Bacillus calmette guerin, is a vaccine that prevents TB in the infants and children. TB patients should always cover their mouth while coughing or sneezing. They should use a spittoon containing household germicide for spitting. Public awareness of health and hygiene is essential. Spitting in public places must be banned. Treatment. Once the treatment is started, the person becomes non-infectious and can live life normally. Medicines must be taken regularly for at least 6 months. Measures taken by the government to control the spread of tuberculosis. World Health Organization (WHO) has recommended directly observed treatment short course (DOTS) strategy to control TB. It is implemented in India as Revised National TB Control Programme (RNTCP) since 1997. Free anti-TB drugs are given to patients under the direct observation of the healthcare providers. Systematic recording and reporting of treatment results of every patient is done till he is fully recovered. It is necessary that the person should get oneself checked by visiting DOTS Center. The Health Ministry works at various levels like national, state, district, taluka and village level to educate people to make a disease-free country. Typhoid. Causative agent. It is an infectious, life-threatening disease caused by bacteria Salmonella typhi. It is contracted by ingestion of contaminated food or water. The bacteria survive in unhygienic condition. It spreads through stools and vomit of patients. It follows fecal-oral route, that is, it passes out through the excreta of the infected person and is transmitted to a healthy person through food. It is also spread by houseflies or directly through contaminated food. It can also be transmitted directly by the contaminated hands of the patient or the carrier. For several months, these bacteria can survive in soil and water. Raw vegetables grown on sewage water also spread infection. Typhoid can be treated with antibiotics. Signs and symptoms. The patient experiences loss of appetite, abdominal pain, headaches, body aches, nausea, rash on the stomach, and diarrhea. The fever is usually as high as 104 degrees Fahrenheit. The fever is high in the afternoon. Prevention. Generating awareness about clean and safe drinking water, sanitation, clean hygienic habits, and eating covered food. Vaccination gives protection for 3 years. Hepatitis. Hepatitis is an inflammation of liver. It can be caused by a group of viruses. There are 5 main hepatitis viruses. They are type A, B, C, D, and E. Hepatitis A, B, and C are contagious. Hepatitis is more common and serious in India. Hepatitis B and C are the commonest causes of liver failure and liver cancer. Virus of hepatitis B and hepatitis C are transmitted by infected blood. Signs and symptoms. The symptoms of hepatitis include jaundice, yellowing of the skin and eyes, dark yellow urine, extreme fatigue, nausea, vomiting, and abdominal pain, loss of appetite, and white or clay-colored stools. Prevention. Hepatitis A and B can be prevented through vaccination. No vaccine is available for hepatitis C and E. As hepatitis D occurs only in persons with active hepatitis B, the vaccine of hepatitis B prevents hepatitis D. It can be prevented by following good hygiene practices such as washing hands thoroughly after using the toilet and before eating food. Use potable water that is chlorinated, boiled, filtered, and ozonized. Blood should be screened for the absence of hepatitis B and C type of virus before transfusion. Rabies. Rabies is a preventable viral disease of mammals. It is transmitted in humans through bite of a rabid animal. Wild as well as domestic animals, especially dogs, are affected by rabies virus. The rabies virus is present in the saliva of the infected animal. It affects the central nervous system. Signs and symptoms. Symptoms usually develop after an incubation period of 10 days. There are 2 stages in the development of the symptoms. 1. Headache, fever, depression, loss of appetite, sometime itching or pain at the site of bite. 2. 2 to 10 days later, the signs of damage to the nervous system appear. The patient experiences anxiety, hypersalivation, disorientation, hallucination, seizure and paralysis, spasm of the throat muscles, hydrophobia, fear of water, and difficulty in swallowing. Death may be sudden due to cardiac or respiratory arrest. Prevention. Vaccination. The rabies vaccine is administered after exposure to virus. Vaccination is successful because the virus takes a long time, that is minimum 10 days, to induce disease. Most valuable preventive measure is through cleaning of the site of wound with soap and water. Vaccination of the pets is an important step in the prevention of disease. Poliomyelitis. There are many children with paralyzed limbs walking on crutches. The disease that has paralyzed their limbs permanently is poliomyelitis, polio. The causative agent is poliovirus. It is a highly infectious disease mainly affecting young children. The virus follows fecal-oral route. It multiplies in the intestine and then invades the nervous system. Poliovirus is found only in human beings. It is a highly contagious disease, especially when sanitation is poor. Symptoms: fever and fatigue, headache, vomiting, stiffness in the neck and pain in the limbs, and permanent paralysis of the limbs, usually legs, are the symptoms of polio. Prevention. As there is no cure for polio, it can only be prevented by vaccination. Oral polio vaccine given multiple times can protect a child for life. Pulse polio immunization campaign. Pulse polio is an immunization campaign established by the Government of India in 1994 to eradicate polio in India by annually vaccinating all children under the age of 5 against polio virus. This campaign also works by generating awareness about the prevention of the disease. Pulse polio uses oral vaccine because it is A. Easy to administer, B. Inexpensive, C. Reaches intestine directly and prevents multiplication of disease-causing virus. AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. Acquired means you can get the infection from someone who already has it. Immune deficiency means a weakness in the body's immune system that fights against diseases. Syndrome means a group of health problems that make a disease. AIDS is a medical condition caused by a virus, human immunodeficiency virus, that is HIV. Infection by this virus can weaken the immune system so much that the system becomes too weak to fight off infections which are usually controlled by a healthy immune system. AIDS was first recognized in USA. The pandemic of AIDS is spreading at an alarming rate. Government of India has started AIDS awareness campaign. Many social organizations have joined in the campaign. Spread of AIDS. Unprotected sex with an infected person. Direct contact with blood infected with HIV. Sharing of needles is common in drug abusers that introduces the virus from one individual to the other. Sharing of razors and blades for shaving purposes is also a risk factor. An AIDS-infected mother can transfer the disease to the baby. Transfusion of blood taken from infected source. Signs and symptoms. Due to weakened immune system, opportunistic infections may occur. Example, TB, herpes, yeast and fungal infections. A weakened immune system can also cause unusual condition like lymphoma of brain, which causes fever and troubled thinking. Cancer of tissues called Kaposi sarcoma is observed. This causes brown reddish spots on the skin. Weight loss and extreme fatigue are general symptoms. The symptoms vary from person to person. Therefore, blood tests such as ELISA, enzyme-linked immunosorbent assay, is the only reliable way to find out. Prevention. Avoid sexual contact with infected person. Use disposable syringes and needles. Common razor in the barber's shop, sharing of toothbrushes has to be avoided. Before receiving blood transfusion, one should ensure that it has been screened for HIV. People are to be educated about transmission of AIDS. There is no vaccine against AIDS.